And the British government faced calls to impose another national coronavirus lockdown. Let's turn to our Graham Thomas. He has more on all of this, joining us live from the United Kingdom. Good to see you again, Graham.
Good evening, Alma. How are you?
Good evening, Graham. So what's expected to come out of these calls to impose another lockdown there?
You're absolutely right. The British government on Tuesday faced calls to impose another national coronavirus lockdown following criticisms that it ignored the advice of experts 3 weeks ago for tougher restrictions to cut the rising infections. Opposition Labour leader Keir Starmer called for a 2 to 3 week circuit break lockdown to slow the rates, saying the government had lost control of the outbreak, having ignored stringent measures suggested by scientific experts on September 21. Health Secretary Matt Hancock told lawmakers the government had not acted on most elements of shortlist of possible virus interventions suggested by the scientific panel, including a national lockdown, because it had to consider the economic fallout alongside health impacts. We make decisions that are guided by the science, taking into account all the different considerations that we need to look to, he told MPs as they prepared to vote on the latest, more limited set of measures unveiled by Prime Minister Boris Johnson on Monday. Johnson announced a 3-tiered system categorizing areas of England by rates of infection to try to simplify a complex web of local restrictions. The northwest city of Liverpool, the only place put into the highest category, will see a ban on household mixing and pub closures from Wednesday for at least 4 weeks. However, England's Chief Medical Officer Chris Whitty, flanking Johnson at Downing Street New Conference on Monday evening, warned he was not confident that the measures would reverse an upward trend that had seen COVID-19 cases quadruple in the last 3 weeks. Britain on Tuesday announced 143 further deaths of people testing positive for the virus, the first time the daily announced toll has exceeded 100 since July. A further 17,234 positive tests were also announced. Whitty urged local leaders in the most affected areas to go further. There's a lot of flexibility in the Tier 3 level for local authorities, so they can do significantly more than the absolute base, because the base will not be sufficient, he said. Lord Mayor Sadiq Khan warned that it was inevitable that the capital will pass a trigger point for further restrictions in the next few days. Johnson's announcement was further undermined by the emergence of the details of the government Scientific Advisory Group for Emergencies, or SAGE, advice. Alongside the circuit breaker measures, they had recommended closing bars, restaurants, cafes, gyms, and personal services like hairdressers, banning different households from mixing in homes, and switching all universities and college tuition online. However, the Prime Minister adopted only one of the 5 recommendations, urging people to work from home. Starmer slammed the Prime Minister, saying that another lockdown was an opportunity to reset and to rectify some of the mistakes that the government had made. If we follow the science and break the circuit, we can get this virus under control. If we don't, we could sleepwalk into a long, bleak winter, he said. Britain's death toll of more than 43,000 is the worst in Europe, and hospital admissions are now higher than when the national lockdown was introduced on March the 23rd. Back to you, Alma.
All right, Graham, so how are people there reacting to another lockdown in your area?
Alma, the people in the UK are mixed in their opinion, ranging from wanting the government to introduce even tighter measures to some even calling for no further lockdowns at all. However, one thing is certain: the longer this pandemic continues, the more frustrated people will become, which could lead to civil unrest. The government are in a very tight position of balancing public health and the economy, with a spending over 1.5 times the normal national spend in health in this area already this year. Something that generations to come will have to deal with. But for me, public health has to be the priority. And we should do whatever it takes to ensure the infection comes under control. And that will mean the effort and responsibility will have to come from everyone. Back to you, Alma.
Okay, so Graham, I want to ask you this from my own. I know you own a care home. I just read that relatives of care home residents will be treated as key workers, and they should also be tested for COVID-19 weekly to enable safe visits as part of a new trial. Could you give us a picture of patient and senior care in the UK, if you may?
Well, we already test the staff in our nursing homes every week. And I can tell you the additional burden that puts on the staff to ensure that testing is carried out. In fact, only today, I did our monthly testing on the residents in the care home. That takes such a long time. To then ask for the care homes to test their visitors weekly, I don't think that's practical, really. We are testing for temperature control, and we're also testing oxygen levels of visitors coming into the home to ask us then to do the weekly testing. I think would be too burdensome.
All right, thank you very much, Graham, for your report, and looking forward to more updates there in the United Kingdom. Thank you very much.
Thank you, Alma. This is Graham Thomas reporting from the United Kingdom for EBC News. We live in interesting times.